Good morning. I'm Amy Allen, Vice President of the Westchester County Association, and it's my pleasure to welcome you to today's All Access Healthcare program. Our All Access programs are designed to bring together subject matter experts to talk about key healthcare issues that are important not only to healthcare providers, but to the community at large. And today we will be getting a firsthand look at what our hospitals and healthcare providers have been going through these last several months, the lessons they have learned, and what we can expect going forward. Ironically, this program was originally scheduled as a live event for April 16th, exactly 5 months ago. Needless to say, that didn't happen, and our two guests were so busy dealing with daily crises that we couldn't even schedule a virtual program until today. But before I introduce our distinguished guests, I would like to thank our series sponsors of our All Access programs, whose logos you can see on your screen. And I would especially like to thank the sponsor of today's program, Healthy Connections. Healthy Connections is the regional healthcare information exchange organization that covers the Westchester County area. And I'd like to ask Diane Beattini, the Director of Customer Engagement Services for the Hudson Valley, to say a few words. Diane.
Thank you, Amy, for the introduction and the opportunity to participate in this morning's program. We're honored to be here and to let you know a little bit more about what our organization does and how we support healthcare providers. We are a qualified entity of the State Health Information Exchange Network of New York, also known as the SHINY. We service 43% of New York State, spanning 26 counties from central New York, the northern and southern tier, and Hudson Valley regions. We are a non-for-profit entity, and we are fully accredited by the New York State Department of Health. We provide the capability to electronically move clinical information among different healthcare information systems, and we offer our participants an array of services that are really designed to enhance patient care, drive efficiencies, and also reduce cost. To learn how we can support your organization, please visit our website at healthyconnections.org, or please feel free to reach out to me directly. Thank you.
Thank you, Diane. It is now my distinct pleasure to introduce our two very special guests. Bea Grause is the president of the Healthcare Association of New York State, known as HANES, and HANES provides leadership, representation, and service to not-for-profit and public hospitals, nursing homes, and other healthcare organizations throughout New York State. Bea began her tenure as the president of HANES in 2016 after serving as president and chief executive officer of the Vermont Association of Hospitals and Health Systems for 14 years. And in that position, she successfully led Vermont hospitals through a variety of reform initiatives, including the very well publicized single payer debate. Before that, Bea spent 10 years in Washington, D.C. in a variety of positions. And Bea is both a lawyer and an RN by training. Welcome, Bea. Our second guest, Kevin Dahill, is president and CEO of the Suburban Hospital Alliance of New York State. The Suburban Hospital Alliance is the advocacy arm of two regional hospital associations that Kevin oversees, the Nassau-Suffolk Hospital Council on Long Island and the Northern Metropolitan Hospital Association here in the Hudson Valley. And these two associations represent nearly 50 hospitals and serve about 25% of New York's population. Kevin also serves as executive vice president for HANES. And prior to Kevin's appointment at Nassau-Suffolk Hospital, he served as president and CEO of United Hospital in Portchester, and also spent a period of over 25 years in the New York Presbyterian system in New York City. Now, sadly for all of us, but certainly not for Kevin, he is retiring at the end of this year, a very well-deserved retirement. And certainly we at the WCA will miss his counsel and support spanning almost a decade. So welcome, Kevin, and I'm sure we'll continue to see you before the end of the year.
Thank you.
All right, well, that's certainly enough from me for the moment, as I know our viewers are extremely interested to hear from the experts about the update from the front lines. And before I turn it over to Bea, I just want to remind everyone, if you have questions as you listen, please put them in the Q&A box, as they'll be curated through our behind the scenes team, as opposed to the actual chat box. So now I'd like to turn it over to Bea Grause.
Thank you so much, Amy. As you mentioned, Westchester is such an economic engine for the state of New York. And I think that's because of the leadership. And what I have learned from the WCA by participating in your events has really helped me personally. So I want to thank you, Amy, and your entire team for the great programming and all the work that you do to keep the leadership of Westchester together, because it has made a difference, certainly during this pandemic and beyond. Why don't we get our slideshow started? Great. So let's, next slide, please. So just to quickly go over what we're going to talk about, just talk about the team effort, our organizations, New York's experience, a little bit of past, the impact on our providers, where we are today, and what we're going to do about tomorrow. Next slide. And certainly the pandemic has been an absolute team effort. It is really hard for me to describe what our members have gone through. Susan Fox, Mike Israel, Derek Anderson, Eileen Egan, Phil Oswa, all of the leaders in this Westchester area probably have post-traumatic stress disorder from all of the daily stress, working 16-hour days for months on end. Kevin and I worked to support them, and all of our partners did as well as trade associations in helping them do the work, and I'll explain that in a bit. I also want to give a particular shout out to the Greater New York Hospital Association. They really led the charge in New York City, which is where most of the pandemic was, and their efforts were truly incredibly helpful to our shared members. Next slide. I remember very vividly on March 2nd, I was called down to New York City to participate in a press conference with the governor when they were announcing that it was the first identified COVID case. As we certainly know now, that was not the first case, really, that the virus had been long in the community. And right after that press conference, I remember the governor saying he wanted by the end of the week to have 1,000 tests a day. We're now at 76,000 tests a day. And as the slide indicates, the tsunami of the pandemic quickly took off from there. At our peak, we were seeing 18,000 patients a day, many of them in ICUs, where the hospitals had to decant their facilities and turn them into major ICUs and discharge many patients in order to care for the COVID patients that they were seeing. Next slide. In terms of our response to that, again, we're a trade association, and we wrap our members and serve them. I want to talk a little bit about the coronavirus itself, and just to give you a sense about how challenging it was. It is called, you often hear it called, a novel virus. That is because really there was very little known about it. So when we were going through the pandemic, they were literally boots on the ground trying to test new treatments that might be helpful. And so in addition to the dramatic ramp up on testing, getting PPE and other things, we were also trying to figure out medically, not we, but medical leaders were also trying to figure out, how do we care for these patients? What is the best actual treatment for them? So there was so much innovation and leadership happening at so many levels. It's really very difficult to describe. But in terms of what we tried to get, the biggest challenge was workforce needs. As we stayed focused to make sure that our hospitals had the ability to care, not just for COVID patients, but for all patients. And patients obviously were still having heart attacks and still having babies, and we had to make sure our facilities were able to care for everyone who walked through the door. And that was incredibly challenging given the rapid increase of patients who needed COVID-19 care. PPE, as you know, was very, very difficult. Many, many challenges with the supply chain because much of the supply chain led back to China, which was still dealing with its own surge. Testing capacity, that still actually remains an issue. But again, as I said before, we have rapidly increased not just the testing capacity, but the testing methods, which I'll talk about in a little bit later. And so that, again, was one of the things that constantly was evolving as we were expanding both the ability to test, but the methods of testing, and then who was doing the testing. There was a lot of collaboration on that particular area between the federal and state government. Regulatory relief, we're still working through that. That's what one of the things that Kevin and I do quite a bit with our teams is really dive into those details in terms of the governor took charge really right from the very beginning, and his staff were working feverishly on really providing that regulatory relief. And so that's one of the things that with that and liability protections that we worked through those laws very, very quickly. And I think for those of you who receive our updates, during the pandemic, we were sending out 8, 10, 12 updates a day on various particular issues that impacted the operations, not just in hospitals, but in nursing homes and other care settings. Relief funding, I will get to in a little bit later, but certainly we knew right away that federal and state relief for members as they were dealing with the impact of a cancellation of elective surgery and the increased costs of providing staff and acquiring PPE at exorbitant prices most of the time was really immediately having a financial impact for them. Next slide. And as we all know, all of the efforts, and I give a huge amount of credit to the governor's staff and the city of New York for doing, working as hard as they did. It was not pretty all the time, but as you saw, as you can see that the testing dramatically increased through March, May, June, and up until today, as we have been able to really dramatically flatten the curve. And again, New York was the first hotspot in the country. As we know now, it's all over the country. And we are a real success story, but I have to say, we still have hundreds of patients in the hospital that are suffering from COVID-19, and we still have people dying every day. So we are not, as we are hearing at the national level, we are not finished with even the first wave of this pandemic, and that is something to keep top of mind. Next slide. Even though COVID-19 was 95% in the downstate region from the lower Hudson Valley through Long Island and in New York City, it did impact economically the entire state. The requirements, again, as I mentioned before, the executive orders and some of the protections and regulatory changes that did happen across the state. I'm just focusing on two. All hospitals across the state were required to increase their capacity by a minimum of 50%. And again, that meant acquiring staff, redeploying staff, and changing them across the state, Buffalo, Rochester, et cetera. And then all hospitals had an elective surgery ban, and it did last for more than 2 months, excuse me. Next slide. This has had a devastating economic impact for hospitals across the state. Both hospitals that cared for COVID patients, again, the revenue loss from the cancellation of elective surgery and the increased expense both of caring for COVID patients and securing staff, PPE, the expanded testing, all of it have reduced their revenues, we estimate, by about 25 to 30%, which the hard dollar number is that $20 to $25 billion number. Next slide. And certainly Congress has responded. I think, as you know, they passed legislation in March that created a provider relief fund. New York has received about $9 billion in funding. This slide here represents the entire provider relief fund at a national level. And so most of our all of our hospitals received funding from the yellow box, which was the first tranche of funding. And then various hospitals, according to it was all formula driven, but various hospitals did receive different funding streams depending on the type of hospital that they were. Currently now, there are about $53 billion in unallocated funds that the Department of Health and Human Services has still yet to release. Next slide. Switching to where we are at the state level and why this is beginning to paint the fuller economic picture. We started the state fiscal year, which begins April 1, in a deficit. The governor, when they started their budget process in January, had to close a $6 billion gap. $4 billion of it was in Medicaid. And when they closed the budget at the end of March, it was already, they already knew they weren't going to implement it, and it was already irrelevant. They, as part of that budget, they had $2.2 billion in proposed Medicaid reductions, which they held off on because of the pandemic. The Division of Budget has now estimated that the revised shortfall for the current fiscal year that we are in today is $14.5 billion. We know that that the 2.2 is built in as part of that, and we anticipate that unless we have federal relief, which Congress has not yet done, we will probably be looking at the state to figure out what else they need to cut in Medicaid in order to close that gap. So we have actively been fighting against that. But again, these numbers are so huge, we are waiting to see what the governor and the legislature will wind up doing. And then again, next year, of course, 2021, and we can talk about the trajectory of the economic fallout from this pandemic as well, but it will certainly impact the state, and that's what the Division of Budget is projecting with the budget shortfall of $16 billion. So a combined two-year budget of $30 billion. Again, unprecedented. Next slide. Looking at how the pandemic is impacting the nation, this slide represents the dark red are cases of 100,000 or more. And you can see the numbers, hopefully you can see the numbers of cases in the various states. And you can see now how that has impacted the country and will continue to impact the country. And I want to talk a little bit about where Congress is today. As you know, we're, I think, 49 days from an election, and we have a Congress that was supposed to pass another relief bill by July 31st. They set a deadline of July 31st, and that obviously has not happened. We are now at the end of the federal fiscal year, which ends September 30th, and so far, no deal. It looks like I'm holding out hope that there is a glimmer of hope that they will try to have a deal. Speaker Pelosi yesterday did announce that they will stay in Congress, at least the U.S. House will, until they have another COVID-19 relief bill. But they're far apart. The House passed the HEROES Act earlier this year with a $3.5 trillion price tag, and Senator McConnell, Senate Leader McConnell was not able to pass a $500 billion relief package, which did not have any state relief in it. Again, we are looking for more provider relief, but we're also looking for more state relief, and we fully support Governor Cuomo's efforts to try to do that because it will help with that $14 billion gap. So we're holding out hope that Congress will pull something together, but they are very far apart. And when you look at the pandemic here across the country, you have many states, and again, it's all ties up into politics, but you have many states that are not as impacted. And those senators, those key Republican senators, are not inclined to provide any more relief. So we are battling that as we get closer to the wire before they go home to face voters in November. Next slide. So turning to fall preparations. Next slide. You know, some things we know are going to happen. The leaves are going to change, and the weather is going to get colder. But there is still a lot that we do not know is going to happen. We already are seeing college campus outbreaks. We're seeing lots of innovation there with new forms of testing, such as the pool testing that is turning out to be more effective. So we are kind of rolling in some up and down with what is happening at college campuses and how that is impacting potential outbreaks and continued community spread. And again, that is really the bugaboo, I guess I would say, is the prevalence of continued community spread. The other challenge is the unknowns around the flu season. The flu season normally takes about 80 to 90,000 lives a year. And again, we are at about 200,000 deaths from COVID-19. And so you add a flu season on top of that, and your already vulnerable populations become doubly vulnerable. So we do expect, as far as all of the rules and regulations around social distancing to continue throughout the winter. So I think you pretty much can count on that. And certainly we all have compliance fatigue. I think we're seeing that. I see that every day in the office, and I certainly see it out in the community. And I think people are hoping that a vaccine is coming soon. Next slide. What we're doing to prepare, again, as trade associations, we are working very, very closely with our members to determine where they are, how prepared they are in particular, but we are also working very, very closely with the state administration on regulations relating to PPE, how much PPE hospitals have to have, and all the details that go along with them. We're also working on regulations. Well, we're not working on the regulations. We're commenting on regulations and in negotiations with the administration on how hospitals should be surging and what they need to be doing. The big issue there, in addition to PPE, is staffing. As we are, as hospitals are required to plan to make sure that they have enough staff. They don't have the staff in-house today, but they have to have the protocols in place so that they can import staff. Again, since the pandemic has changed, remember in the spring, New York was the only hotspot, so we were able to import healthcare workers from other states. That's not the case today. So there is a national shortage of qualified healthcare workers. And so if we do have another surge in New York State, we have to be prepared to try to find enough staff and make sure that we know more around testing, quarantining, contact tracing. And so I think we are working on how to more rapidly make sure that we are containing any growth in the pandemic. And again, hats off to the governor's leadership. We've had dozens and dozens of conversations about how we've gotten smarter and how we are trying to make sure that we have these plans in place, and that should we have to execute on those plans, we will work very quickly and smartly to make sure that should an increase in cases happen, that we can contain it and keep it from becoming as widespread as it was in the spring. So that is really the essence of what we're trying to do. Obviously, we're all eyes are on a vaccine. I do not think a vaccine will be ready in 2020. I do believe and hope that we will have a vaccine hopefully by the spring of 2021. But there's a lot going on. Billions are being spent by about half a dozen pharmaceutical companies now who are working very, very hard on a vaccine. Challenge with a vaccine is you have to make sure that you are communicating, that you have crossed every T and dotted every I, so that Americans are comfortable taking that vaccine. And that is always going to be an issue. So and any vaccine that's produced is useless unless people feel comfortable to take it. Next slide. Basics, what can you do? I think what you're already doing, I think, you know, as a small organization, we are working half-time here. We have multiple COVID protections. We have hired a nurse to take our temperature as we walk in the door in the morning. And I'm sure many of you are doing the same. You're gonna have to keep doing it. There's just no getting around it. And again, working through these basics, which have now become habits. I can't tell you how many times I've had to run back in the house and get my mask and make sure I've got everything I need. So, so again, keep doing the basics. Next slide. And again, in closing, we have gotten through an incredibly difficult time. As a former caregiver, my hat's off to all of the heroes on the front line, and again, all of the people who have supported them in the hospital. We could not have done it without the resilience of thousands and thousands of healthcare workers and leaders who support them. And again, for the business community, we want to work with you to make sure that we are keeping New Yorkers safe and make sure that we prevent a fall pandemic. That would be the ideal. And I hope that we will continue to persevere and show the rest of the country how to keep the COVID-19 pandemic at bay. So with that, I will conclude and hand it over to Kevin.
Thanks, Bea. Well, that certainly was a very comprehensive summary of everything we've been dealing with over the past 5.5 to 6 months. And as Bea said, particularly in the first few months, we were quite consumed with working with the health department and the governor's office to try to, you know, almost on a daily basis, deal with the new regulations and guidances that were being put in place. I want to just take a few minutes to provide a little bit more of a local overview of how we worked through this pandemic, particularly in the first 3 months of the outbreak. We have an entity in place in the Hudson Valley that has been in place since following 9/11. And it's an organization called the MACE, the Mutual Aid Coordinating Entity. It has 31 representatives on it from all of our hospitals, as well as we even include the Keller Army Hospital at West Point in this entity. We have a couple of staff members in our regional association that serve to support that entity. It's funded in large part initially by the federal government through the state, as well as the hospitals make financial contributions to it as well. During the past several years, it's been through that entity that we have had an emergency preparedness program in place locally. That it is through that entity that we run all of the drills that we have run at our hospitals. And we present scenarios in those drills that the hospitals have to react to and respond to. And then we do a critique to determine how well the hospital performed during those drills. It is also the way in which we communicate with the 7 counties, the departments of health, the EMS group. So that's been in place. It's been very fortunate that it's been in place in the Hudson Valley. Now, we've never presented a scenario in any of these drills, the likes of which we had to go through in the past several months. No one could have dreamed of what we've had to encounter. However, having this entity in place really gave us an advantage in terms of at least communication. And initially, when the numbers started to escalate quite dramatically, and there were shortages of PPE and even some select staff, it was through this entity that we were able to share equipment amongst the hospitals, and in some cases even share staffing. So we're very fortunate to have an entity like this in place. Some of the leaders from our hospitals who coordinate emergency preparedness on behalf of the hospitals worked tirelessly to support each other. It was quite invigorating to see how the hospitals really did support each other through this. So wanted you to know that that has been in place, will continue to be in place, and benefits us all. Bea mentioned March 2nd, where the day in which she was invited to come down for that press conference with the governor about what was thought to be the first case. Turns out it wasn't exactly the first case, but it was here in Westchester, in New Rochelle, you may recall. A local attorney, his name has been publicized, but I'm not going to torment the poor man anymore. But he had been admitted 2 days prior to March 2nd to Lawrence Hospital in Bronxville. And initially, the physicians thought that he was so sick that he probably had very complicated pneumonia. But on March 2nd, he tested positive for COVID and went into a coma and spent 3 weeks in a coma at the hospital. Turns out he had not traveled out of the country as was initially suspected. So it's not terribly clear how he contracted the disease. However, through contact tracing, we were able to determine that he had been at social settings, very much tied to his synagogue in New Rochelle, where a few hundred individuals also tested positive for the disease. His wife and kids also contracted the disease. Fortunately, they did not get anywhere near as ill as he did. But you may recall that this case study became a microcosm for what we encountered throughout the state and now is being encountered throughout the country, in that the governor put in place a 1 mile isolation zone in New Rochelle, sent the National Guard in, if you recall, to help support that effort and contain people, and was allowed to do a lot of contact tracing and then implement some testing. At times it's always great to be the first at something. This was not that time. But in fact, we were in Westchester. We were the first to have to deal with it. We were the first hotspot, if you will, and it really stressed the system. We had a nurse who worked at Lawrence, who cared for this gentleman who contracted the disease as well. So this was a very trying case example of what was to come. And the Lawrence Hospital staff really needs to be applauded for how they dealt with it and how they're still recovering from it. I want to close by just emphasizing, Bea talked about our consultants have estimated what the losses are for the hospitals. But you saw on one of the slides that Bea presented that one of the orders the governor issued during this outbreak was that not only had were the hospitals required to surge their capacity by 50%, but they had to close down all elective surgeries and procedures. And that order got lifted about a month and a half ago. But however, we have not yet seen a return to the volumes, the patient volumes that we had before the pandemic. And I know it sounds terribly self-serving to say, well, that is just going to add to the financial misery of the hospitals, and it is. But it also suggests to us that the public is foregoing patient care, probably because they're afraid. They're afraid to come back to the hospitals because they don't want to contract the disease. We've done a media campaign about this to try to reassure the public that it's okay to come back. We have seen, though, very little increases in patient volumes. So wanted you to know that. I'm sure the medical groups, some of whom might be on this call, may be experiencing the same thing as well. So it's important that you know that. It's important that you feel comfortable reassuring people that at least at this point in time, we're in a stable situation here in New York. Whether that will continue throughout the fall, we don't know, but we do monitor this on a regular basis, and people can feel at least comfortable for the time being in coming to their hospitals for the care that they need. So Amy, I'll turn it back to you for questions. That's the local flavor, though.
Great. Well, thank you both. And I want to echo comments that you both made about recognizing the unbelievable work and sacrifice of everybody who works in the healthcare field. It's pretty remarkable when you think about what so many of your employees, your members' employees have gone through. And I would certainly be remiss if I didn't let everybody know that we will be highlighting our healthcare heroes at our annual leadership event on November 19th. We'll be doing a video about it. We'll have Dr. Phil Oswald of Montefiore as a excuse me, keynote speaker. So go to our website and check that out. It's really important. So just a couple of thoughts and questions from me, and then we'll get to some questions from the audience. Obviously, when we see the financial impact to the hospital sector or the healthcare sector, it's enormous. We consistently talk about healthcare as the greatest economic driver in our region, employ the most people, obviously provide an unbelievable service to the community. But the ripple effect is not really just in the healthcare sector, unfortunately. Throughout so many other sectors, particularly hospitality and small business, they've been impacted. So I don't know if you have any crystal balls or any prognoses as when some kind of normalcy might return and businesses and consumers can start to feel a little more comfortable.
I'll take that there. I don't have a crystal ball, but I also, want to be realistic and say that I think 2021 will be challenging. When you think about the disruption, not just in hospital activity, which we focused on today, but also economic activity, where people weren't going to restaurants, people weren't going shopping, they weren't going to the laundromat, et cetera. That has caused a huge impact, as we all know, across the spectrum. And that is going to continue to challenge until we get, until we are well beyond this crisis and the restrictions that are placed on us to keep New Yorkers safe. We are going to have constriction in that vital economic activity. So, which is why we think that federal relief is essential. It doesn't look like it's going to happen in September, but I think again after the election, there's still going to be the likelihood of a relief package, perhaps in a post-election session or in January with the new Congress. So I think that there will continue to be federal relief, an effort to do that across the country. The challenge again is national politics of trying to deal with the various needs across the country and how we bring that back to New York. I think my worry about how this pandemic has played out is that, the pandemic that the hotspot that New York experienced way back in the spring is 50 political lifetimes ago, as far as Congress is concerned. And so that's part of the reason why we did the Kaufman Hall number, so that we had a number that was lasting, that we can continue to remind politicians that New York still needs relief.
So as you know, and Kevin knows as well, one of the things that our organization tries to do is to be your partner in some of these advocacy initiatives, kind of adding the business community focus to it. And I mean, we did send a letter, we meaning almost 100 organizations throughout the state. Both of you, I believe, signed it as well, to the congressional delegation asking for additional relief. Are there some other more specific and targeted asks that we should be focusing on either at the federal or the state level?
Kevin, you want to take that, or?
Yeah, sure. Well, at the state level, I think right now, the state's in a bad way. And I don't know that we can ask for anything until we see what the governor decides he needs to do about the existing deficit and what's going to be projected for next year's deficit. So, that being said, doesn't mean that at some point we wouldn't want to participate with the state in addressing some of these issues. But I think at this time, the situation is just way too complicated at the state level.
Yeah.
At the federal level, my hope, well, I think Bea is absolutely right that so much has happened in the past 6 months that what happened to us is seen as almost, in the history books now. And I think there are some in Congress that are saying, we already gave them money. We gave the hospitals money and whatnot. But the fact of the matter is that it wasn't a sufficient amount of money. The big systems, and I mean the big ones in the city, Sinai, Presbyterian, NYU, are all reporting mid-year losses, very significant losses. And that's net of the money they got from the federal government. And with volumes not returning, it's going to get worse.
Mm-hmm.
So I think the pressure has got to be kept on our congressional delegation, particularly Senator Schumer, who, it's not from lack of trying on his part, but he needs to be able to say, my phone's ringing off the hook, and I'm hearing from the business community as well as the healthcare community, and others. So I think that's where you can be a big help to us and to the state. And when we say support for the state, we're also talking about the localities.
Mm-hmm.
The counties are in big trouble as well. And if they don't get some relief, this is going to have dire consequences. Somebody was saying earlier that yesterday was reported that 100,000 restaurants throughout the state have already closed and are not reopening. So when you think of this ripple effect, it's going to be quite significant, and it's going to go throughout 2021, in my opinion.
Yeah. Amy, one addition I would say is that, the increased use of telemedicine during the pandemic. I mean, some people say that we advanced 5 years and 6 months with the increased use of telemedicine. And one of the things that Kevin and I are working on with the administration is to go through all of the regulations that change to help make that easier, and looking through to try to make some of those regulations permanent. So I think the business community's support of that would be very, very helpful.
Definitely. All right. So to the extent that there's specific pieces of legislation that we should know about and advocate for, I think that's very important. There's a couple of questions that came in from the audience, some of which were addressed a little bit on. Somebody had asked about whether there'll be enough PPE if there's another surge of the virus. I know, Bea, you spoke to that a little bit, but are there specific types of PPE that are more needed than others, or if you wanted to just address that quickly?
Sure. I think the short answer is yes. I think we will have enough PPE. We've been working very, very hard to make that happen. And I think, as Kevin mentioned, I think the systems are now very experienced at moving PPE around to make sure that particular areas have what they need. There has been a national shortage on gloves, and there has been a particular shortage on small N95 masks. But what is, speaking to the innovation of healthcare providers, is that many are now starting to use reusable masks. You see some of the big, the big plexiglass masks, and so those, and even reusable gowns now are starting to come online. So that will help, but I think we are going to have enough. I think we'll be in good shape.
That's good to hear. Okay, Kevin, this is just a quick question. Somebody asked to repeat the acronym for that mutual aid entity. So was that MACE?
MACE, M-A-C-E.
Okay, thank you. And then another question, which I don't know the answer to, nor there was a potential new treatment announced yesterday. Are either of you familiar with what that is? I'm not sure what the reference is.
Yeah, I'm not. I think it was an adjunct treatment to remdesivir. I can't remember the name of the treatment, but it was to be used with remdesivir. I don't know that much about it. I was not. It didn't strike me as being a magical treatment in the sense that it reduced the average length of stay by a day. So again, since as Kevin was highlighting, we have had patients 2 to 3 weeks on ventilators and 4 to 6 weeks in a hospital. So I'm not sure it's dramatic, but we will continue to learn about that. But again, it just certainly speaks to how novel this virus is and how much we are continuing to learn.
Exactly. So speaking to that, I know obviously we're continuing to see cases. They have not gone away. Maybe they're not in the same numbers. I've heard a little bit anecdotally that some of the, I guess you call it the acuity of the cases or the symptoms that the patients are presenting with are a little bit different than they were in the beginning, not quite as severe, and or the treatments, or maybe the treatments are more effective. I don't know if that's an accurate assessment, or if you could comment on that.
Well, no question that overall volumes of COVID cases are way down from where they were, but also our deaths and the use of ventilators has significantly been reduced. Now, some of that is, as the clinicians have learned more about the virus, they have developed new ways of intervening and caring for some of these patients. And so that has resulted in less use of ventilators and extended stays and so on. We can only hope that with eventually a vaccine, come the spring or at some point, that would, begin to reverse this whole curve. But yeah, I mean, not only has there been a reduction in volume, there's been a reduction in severity, it appears.
Okay, that's good news initially, for sure. I'm going to read a question that an audience member sent in. I'm not 100% sure I understand it, but I will read it. It says, is it possible that the significant number of deaths in nursing homes reduced Medicaid expenses significantly? How were the nursing homes affected? Well, I guess the second part you can answer about but I'm not. I'll see if you can answer either of you the first part, if that makes any sense.
Yeah, I'm assuming that the intent of the question is that because there were, I believe it was 11,000 deaths in nursing homes. Did that reduce Medicaid expenditures? I don't know the answer to that question. You know, it would be, I'm not sure it's even calculable because of we don't know the age of the patients, et cetera. There's so much variation with the individuals. I will say that Medicaid spending did not go down during the pandemic. It went up because enrollment went up. So, so while there may have been some decrease there, there were increases other places. So I don't know.
Okay, thank you. Actually, I have a question, Kevin. This is something you and I talk about. There was obviously the reduction or the cessation of elective surgeries, right? Which insurance companies normally have to pay for. So theoretically, they weren't having to pay for any of those. Yet many of us are seeing insurance premiums that have gone up double digits. I'm sure you're dealing with reimbursement and denial issues that you've always dealt with. Any thoughts you want to add to one of our favorite topics?
Well, I would say that, you know, throughout this ordeal, I regularly was receiving phone calls and inquiries from business associations such as yours, colleagues of yours in other associations, elected officials, you know, just leaders in the various communities that I represent, asking what they could do to help. Is there anything we could do? You know, this must be an awful thing and that you're dealing with. And the only constituency that I did not hear from were the commercial insurers. I mean, not a peep. And it was only after Bea and myself and our colleagues from the other regional associations wrote a joint letter to the Department of Financial Services indicating that the payers really should be brought into this. The state did step up, you know, and I give them a lot of credit. And they ordered the insurance companies to work with the hospitals to advance receivables, if possible, to help with cash and so on. And even then, the payers were very slow to act. We had to really force their hand. So we can only assume that they, in a bizarre way, benefited financially from this ordeal. Because
Kevin, they have. I mean, their earnings for this past quarter have been unprecedented. So,
yeah.
You know.
So, and we also know that they've put in for these double-digit premium increases, and we have we've been pleading with the Department of Financial Services to really ratchet those back, and I would expect that that's going to happen.
Yeah.
But it's really important for the employer community to know about the behavior of these insurers during this time.
Well, and I would add, I think employers can push back on the plans as well, quite effectively.
Yeah, they should. They should.
Yeah, well, it's time to revisit some of the things we talked about 10 years ago about really forcing the insurers to be better community players and perhaps the Community Reinvestment Act model that the banks were regulated to do. Something we're going to be looking into, and we'll reach back out to you about that.
Amy, we can absolutely work on that. We've already been talking about that. So
great. Well, we
would love to work with you on that.
Absolutely. Okay. And so we'll definitely follow up on that. Let's see if we have, so here's kind of an inside baseball question. Given these traumas, I'm guessing meaning the effects of the pandemic, where are we with the DSRIP efforts? And some of our viewers may not even know what DSRIP is, but for those, I'll let you answer that.
Yeah, sure. I'll start, and then Kevin, you can certainly pick it up. DSRIP is an acronym, yet another healthcare acronym for Delivery System Improvement, and I forget what the R, but program. It was part of the Affordable Care Act, which passed many years ago in 2010. And it was designed to do what it said, which was to really help improve the health of communities by changing, not just changing the entire delivery ecosystem, so to speak, not just with a hospital, but with community-based organizations and other healthcare providers. So there was $8 billion that was provided to New York. There were 25 district hubs called PPSs, another acronym, where the community work was supposed to happen. But that funding, unfortunately, under this administration has expired or is about to run out. So one of the challenges that has happened is that when you start any experiment and you can't hardwire the funding and turn that into the new normal, that all of the good that you did begins to unravel or become assimilated into other communities. And I know that many hospitals and health systems have assimilated those PPSs and the work that the district funded into those into the organization of the health system, but some of them have gone away. So, and Kevin, you may have a more local flavor for that answer.
Mm-hmm. Yeah, I would just add that, you know, the initial funding was a waiver that the federal government provided to the state with the caveat that the performance of these hubs had to meet the goals that they had set forth, which got them the funding. Recently, we learned that the federal government took a look at that, and at least in our 2 suburban regions, there was no money taken back from our entities that participated in this program. So that would suggest that the federal government found that they met their goals. They were on the right path. They were reducing unnecessary admissions, fostering more outpatient care. You know, those things that we set forth as the goals for this program. Now the question will become, as Bea suggests, without the funding, can we keep those activities functioning? Added to that is obviously what we've just been through with the pandemic, which makes it hard for us to even take a look at it right now. But at some point, we're going to have to.
Okay, thanks. One other question that I have, and it also speaks to something that we are very engaged in here at the WCA, that goes back to the workforce needs. I know Bea addressed that in her presentation, but are you finding that across the systems, or maybe it's very specific hospital by hospital, are there certain types of positions that you think, given what we've gone through, are going to be more needed in the future, and that there aren't enough of, if that makes sense?
No, that's a great question. You know, I think we need healthcare workers that have the ability to be cross-trained, to have that flexibility. And certainly with the surge and flex regulations, just to give you a concrete example, you know, I'm a former emergency room nurse. You know, to cross-train me to the intensive care unit, I have those critical care skills, but I'm not necessarily familiar with the ICU equipment and protocols. So I think that type of cross-training is going to be critically important, because the first line of defense is to make sure that you're using the workforce that you have as efficiently and effectively as possible. So, so I think that's one, but certainly critical care training will be incredibly important.
That's a great point, and I know you know, we work with a lot of colleges in our region for sure, nursing schools and allied health programs. I think that's really excellent intel for them. So thank you for that. I don't know that we have any other questions from the audience. This has been great. I mean, I could sit here and talk about this all day, and I really appreciate both of you taking the time. I know clearly how busy you are, and it only took us 5 months to get this on the calendar. So you know, I'm glad that we did. I'll just ask each of you if you have a couple of closing comments before I wrap up.
Kevin, you want to start?
Sure. Through any kind of a crisis, whether it's a personal family crisis or a professional situation like we've gone through, there are takeaways that can be very positive. And even though I've been in this business all these years, I truly became invigorated to see how our members responded and dealt with this situation. And it's a new fond respect that I have for them. And that would be a message I would want to convey to the public, that I know there were public displays of appreciation, people applauding at 7 p.m. and all that, but I'm here to tell you that this was an emergency like no other that I've ever seen, and a response like no other that I've ever seen.
Yep, and I guess I would conclude by expressing also my gratitude and appreciation for what we all went through. I certainly learned that we can do hard things. As a relatively new New Yorker, I love the can-do attitude of New York, and I do believe that we help to lead the way for many states across the country. And I know that we will persevere through whatever comes next and continue to fight. And I think the New York tough attitude is one that, in our advocacy worlds, we'll continue to fight and continue to work with others to make the world better, and continue to work on healthcare, make it affordable and accessible for everyone.
Yeah, thank you. And we're fortunate to have leaders such as both of you, marshaling the troops and getting the word out. And we certainly look to do our part and be good partners.
You're a great partner.
Yeah, well, thank you.
Absolutely.
Well, we appreciate that. So again, I want to thank everybody for joining. Thank you to our sponsors. Thank you to Healthy Connections, and join us on November 19th, please. It's going to be a great program. And everybody stay healthy and stay well. Thank you.